Welcome to the Back in Action podcast, where you're going to hear from me, a spine physician, Dr. John Lavelle, and two coaches, Dusty Holden and Josh Bunch. We're going to help you rethink pain, rebuild strength, and regain function so you can get back to enjoying the things you love in life without limits.
Welcome to Back in Action. Coach Josh here with Coach Dusty Holden, Dr. John Lavelle. Today we're talking about fitness myths, physical therapy, medical community, and we're just going to shut some things down and break some hearts. Dr. Lavelle, we're going to start with you. What is a myth that you hear every day or all the time?
There's lots of them out there for sure, and I think this is going to be a fun podcast. We're going to piss off some people and make some people happy, because I think we just need to be brutally honest, because there's a lot of nonsense, I think, in the medical community. A lot of it's money driven, and doctors want to make money, physical therapists want to make money, but also, I think the best money to be made is word of mouth, and when you're treating people and they get better, you're going to have endless patience. But probably the most common myth I hear is people come in, they've seen a primary care doctor or another specialist, and they didn't see their MRI, but they were told from a report of their MRI that they have a disc bulge or disc protrusion, disc herniation, and that's their problem. So they have to be careful. And immediately those patients become scared. They become fragile and very fearful. So they don't know what to do. And oftentimes they're never told what to do with it. They're just told, you just got to rest or avoid lots of different things. And that just ruins their life. And it just compounds over time because they're fearful, like, I can't do this. I can't bend over and tie my shoes, pick up my kids. And it just turns into chronic pain. But so much of our back, yes, disc bulges, protrusions can cause pain. It's usually not the only source. But even if you have a disc bulge, we all have one in this room. It happens as early as our teenage years. We'll see some degree of what we call desiccation, or losing some of the fluid or hydration in the disc. And that just continues through life. There's ways to slow that down, exercise being key to that. But it happens to all of us. So just because you have an MRI finding doesn't mean it's a permanent thing that you have to have. The pain doesn't have to be permanent from that. You're never going to change that disc problem, but the pain doesn't have to be there because it's universal, and most people don't have persistent pain from a disc. So what I always tell them is the opposite of usually what they're told is we have to get you moving immediately. So when you have a disc bulge or anything in your back, whether it's ligaments or arthritis causing pain, that pain causes an inhibitory feedback to the muscles and shuts them down. And so some of those core or trunk stabilizers, the deep stabilizers, turn on automatically without you even acknowledging or think about it when you go to do a movement. That being the multifidus, transverse, abdominis are two specific ones that in those initial movements of lifting or bending or loading the spine, they turn on and you're not actively doing it. So if there's pain and that shuts those muscles down, well, then you automatically lose that initial stabilization there. Okay. So you're setting yourself up for worsening pain, but also worsening injury if you're losing that deep support of the spine. So working on exercises to strengthen those initially is the first thing people need to be doing, and immediately.
So is the first part of the myth that we need to do nothing when we have the diagnosis of a herniation?
The first part of the myth is you have something on your MRI and that's the problem.
Okay, got it.
So that's not usually the diagnosis. Okay, or if it is, then what you just said, it's not do nothing. It's let's attack this so we get rid of it quickly. And then as you strengthen those core stabilizers, meaning when people use the other myth is, strengthen the core. To me, the core is more your trunk muscles from your elbows to your knees and everything in between. That's what we got to be strengthening. But those initial stabilizers of the spine, you can start strengthening right away. It rarely is going to worsen your pain. Simple things like we've talked a lot about, pelvic tilts, simple, small, gentle movements that'll start activating that multifidus muscle with simple back extension exercises or hinges. Rotation, activating that transverse abdominis deep muscle is going to start to stabilize that spine. And then progressing from that, adding in other lifts, squats, deadlifts, carries. Those are kind of the big three in my mind that everyone has to progress to if they don't want to have persistent flare-ups in their back or chronic back pain. If they're not adding those in, then it's going to be good for business for the physician that told you to avoid those, but not good for the patient. Okay. And people say, well, do you have data on this? What's the literature? you can Google, should I do functional strength training for my back? And the answer is a resounding yes. Put it into your favorite AI or Google search. And the literature over the last 5-10 years has really proven this out. Now, I've been doing this out of residency for about 15 years. And I've always kind of gone this way. Not that I'm anything special, but I just practically, it makes sense. If you keep things moving, as we talk about all the time, movement is medicine. It really makes a big difference for pain, especially in the spine. But I mean, I see 5,000-6,000 patients a year. I think that's good enough data over the last 15 years for me to know this really makes a difference. Not because I want it to, but because I've seen it. I don't make money off having people do exercise. I would if I do injection surgery, different medications and stuff like that. But I just want to get patients better. And this is what the avenue that really makes a difference.
How much of this, and this may be another myth, is tagged to the idea that you need a diagnosis to be able to move forward?
Well, that's true. And so let's give an accurate diagnosis. That's another myth is, a myth per se is, their diagnosis is, you got low back pain or you have muscle spasms. That's great, but those are symptoms. What's causing that? So is it a nerve being irritated? Is it arthritis in there? Is it deconditioning of the muscles or the ligaments around the spine? Which is so common to cause. Though that MRI may show something, that's, rarely the only problem going on.
With this, and Dusty, I have a ton of stuff that I know we have to talk about on what we see in the gym every day, but this makes me, I always wonder would it be almost, maybe not safer to say something like that, if I'm not doing any sort of fitness, let's just arbitrarily, what's the average age of your patient coming in the door? 35, 45?
I would say mid-30s to mid-60s.
So let's just go with that. Let's just say somewhere around 40 that comes in. If they were to say something like, I'm doing no fitness whatsoever, would it be better for them to have started fitness and then see if they need
100%.
So the start shouldn't be this then that. Shouldn't be doctor to coach. It should be coach, and then therefore, if nothing is resolved, assuming I had a good coach, then doctor.
Yeah, and I mean, ideally, everyone, once you're in your teenage years, that should be just part of the lifestyle is movement or some type of fitness. We know in reality that's not the case, but if you haven't been doing it, the reason people go to physicians is they're quote unquote the expert. So they want to find the expert opinion and then go to the coach or trainer or therapist, which, like you said, is kind of backwards. Why don't you try the fitness first, moving, obviously in the right hands. You don't want to just go to Joe Blow down the street that doesn't know what he's talking about, but go to someone that's intelligent about fitness and see if you can start moving.
Well, I think it's important too that the person, whoever you see, I mean, one of the big things is you see 5,000 to 6,000 patients a year. I've been working with your patients for 8+ years, and whether the data is there and showing that this helps. I mean, we've seen it. I mean, there's been thousands of people who have came into the gyms that we've worked with, and I mean, it's unanimous that they've improved or even just completely gotten out of pain. So it's something, it works. That's why we're so, I think, adamant about, sharing the information, is because we firsthand, it's the approach that we take on a daily basis, and we see the impact that it has on people. And going back to like what you said about if you start with fitness, it's like, I think that's huge. If you're watching this and the reason that you're watching is you've got some, back pain or shoulder pain or whatever, some sort of pain, is the first step would be, hey, why don't you get moving and just see if you get improvement. If you just have that persistent pain, then maybe it's worth going and getting checked out. But at least you've already taken a step, that there's no question about it. It's a positive step, and then maybe if there's like reassurance needed, it's like you can always, go the physician route. Because I think there is some like confidence there. 100%. Most of the folks that come in from you, they feel a lot more confident in walking into the gym because you've said, hey, this is your situation, and I want you to go do this. So there's a little bit.
We're not saying pain's not real.
Right. No. That's exactly
100% real.
Yeah. If you're feeling pain, there's a root cause for it. But
then secondarily, we've also talked about in this podcast many times, how do you qualify what that good coach is versus somebody who's just giving you, come in and just throwing a template at you or handing you a slip of paper and saying, do this. And I think that it goes back to the thing you've said probably more times than any other, and what the patients, athletes you send to me always say is that Dr. Lavelle actually listens to me. I think the first, just the test when you walk right in the door, do you actually talk to your coach, and do they ask you questions? Like, and,
right.
you know, when does it hurt the most? Like, what's the things that freak you out? What don't you want to do? Those are really simple questions. And I think if you don't get that when you walk in the door and a coach is like, let's go do this thing without getting any history, that coach is doing a disservice. Now, it could be that, and we talk about this a lot, it differs by degree, not scope. We still want everybody to be able to pick things up off of the ground. We still want everybody to be able to sit in a chair and stand up. So those movement patterns are going to look clear across the board. But the way that you get there, the duration.
It's a different approach.
Very much so. Very much so.
No, I think that's, listening is, I think it's everything, you know? And, you know.
Well, for me, it gives me pretty much the diagnosis.
A lot of times
if you spend 5 minutes listening to a patient,
they'll tell you.
I usually know what's going on. The MRI may confirm it. The X-ray may confirm it. My physical exam may confirm it. But usually they're walking in telling me. And usually they're walking in saying, you know, I used to be active. I stopped being active. And then my pain came back, or my pain started.
They know what they need to do.
It's
just not doing it. And that's where it's like, you know, just that nudge, you know, in the right direction is, I think it's a positive reinforcement.
Now, you can overdo it too. It doesn't mean exercise is the answer and you just go 7 days a week and go hard in the gym. There's overtraining too. So it's finding that balance. And that's where speaking with someone that's knowledgeable, whether it's a physician, physical therapist, trainers, you know, you still need that knowledge base to know how to train and what to train.
You know, when you go see a coach, it's important that the coach is teaching you how to move, you know, talking you through the movement pattern, whatever it is that they're having you do. They can at least tell you, you know, where you should be feeling this, how to do it properly. Because a lot of times, you know, people, they may be doing, you know, deadlifts, so they may be doing squats, but there's a technical flaw, you know, that, and then they just continue to load it.
What programming here?
Could be that.
You squat too much. You squat 7 times a week.
And so all those things, I think, is where a coach can help, you know, just navigate that.
That's right.
That's the second biggest myth. I'm jumping in here, but is don't squat, don't deadlift. I mean, that's myth number right up there with the MRI gives you the diagnosis is don't do these certain movements. And that almost always it's deadlift, then it's squat.
Well, because people don't understand, like, you had to do those things to get in the doctor's office.
Well, 100%.
You know, it's like
you got your ass out of the chair and you bent over and put your shoes on. You just did a squat and a deadlift.
You got
so if you
car,
don't
you
do
got
that,
out of your car.
That's right.
So I think that's where, you know, people are just, they don't know what they don't know, you know, and that's okay.
Well, I think it's okay for the patient. It's not okay for clinicians to be
I agree.
educating and guiding their patients that way.
I think physicians need to understand the power of their words. You know, it's like when you tell somebody you should never do deadlifts or never squat, the power that sentence has over their life, and then the long-term effects of if they walk out of there and they choose to, like, just, you know, hang on that word.
If they abide by what you say,
I mean, you just sent them down. I mean, it's a really dark path that's going to lead to probably a lot of other issues. Obesity being one. You know, it's like when you start taking things away. Now you start to have. I mean, now it's went from pain to, like, lifestyle. And, you know, you've had a significant impact. And it's like the thing that I always go back to you. It's like, I think we need to be asking more questions of, like, do you lift? You know, what do you do for your back? How do you manage? You know, do you have back pain? So those are fair questions. You know, you don't want advice from a broke financial advisor. You know, but we will take advice from a overweight physician, you know, and so it's they're making those same choices, and I think that stuff matters because if they're going to tell you, you know, not to do these things, well, is that the same, you know, rules that they live by in their own life? And maybe it is, and probably the proof is in the pudding, you know.
How do we tell our listeners to be able to break down some of those walls that they may have heard? I mean, we don't want to just just willy-nilly tell them to run out there and start squatting. But if we've seen the positivity of actually going squatting, deadlift, and carry, how do we go against what people may have heard? And how do you do that in the gym where you're like, hey, man, this is where we need to be? Obviously, you have Dr. Lavelle who sends them in that says trust, but not everybody's like that.
Well, I think I misspoke earlier when I said 5,000, 6,000 patients. It's patient visits. So a lot of those are duplicate patients for revisits. I'm not that good to see that many patients. But anyway, to get to your point, is with all those patients I've seen and all the new data supporting this, it's just giving them that information. So being up to date with what is current and shows works for pain. And you'll see, you can open any news and it talks about fitness as health for longevity, for being good for cardiovascular, pain. So it's the information's out there. It's how do you implement that? But so I kind of describe what that information is, why it's beneficial, but also how it's beneficial. So if you start, we got to think, what causes our back pain? We talked about the disc briefly earlier, but maybe it's arthritis in the back, or maybe it's just muscle deconditioning so the muscles aren't firing. So we got to treat that. And the good thing is strength training is going to treat all that. As I said, it'll help stabilize the spine to support that disc so you don't get all that axial loading if you strengthen the muscles and the ligaments around it. Same with arthritis and the joints, the facet joints of the back, same principle. But it's how our, the kinetic muscle firing. If you're not working to strengthen the posterior chain paraspinal muscles, the glutes and the hamstrings, and getting those to fire appropriately, well, then you're going to get muscle strain or muscle strain patterns that are abnormal because those muscles aren't firing appropriately. So if you're doing exercises to train, strengthen those muscles up, squats, deadlifts, carries are going to help with all of that. You're going to have normal muscle firing, so it's going to transition to carry over into your day-to-day life where you're able to do those things without pain. So when we load our spine, the spinal elements, the discs, the joints, the ligaments, all those are becoming stressed. And if you're not strengthening around it, those areas are going to become painful if there's something underlying that's wrong, whether it's arthritis or a disc. So those may be there, but if we're strengthening everything around it, you're not going to get that pressure or that load on those areas.
The coach knows the appropriate amount of pressure to put the athlete in to be able to get adaptation. Adaptation is what's necessary because we've essentially deconditioned from a lack of use. Yeah. So now to get back to where the things don't hurt or the volume gets turned down on that pain, you have to not necessarily poke the bear, but a little. You're touching into the things that are hard enough to produce change.
Yeah.
What are some of the things that you see that people have said that's a little outside of this that you have to break down, dispel on a regular basis inside of the gym?
Well, I think it just comes down to, they've gotten a diagnosis and they've just stopped moving. So they're lifting no weight. Mm-hmm. And then movement patterns start to change. So now they're no longer squatting. They're doing like this sort of half lunge. Mm-hmm. And then they're bending, more through their upper back than they are hinging, at their hip. So now you've kind of, you've started to just alter the way that your body was designed to move. Mm-hmm. And so I would say in most circumstances, there probably are in more pain, so the pain, it only continues to worsen. So now it's like when we say, all right, we're going to squat, and it's just a squat to a chair or a bench or wherever we're at first, that's like, sometimes it takes people back a little bit because they've been told not to do that. And now that's one of the very first things that, we kind of have a reputation of we attack the areas that everybody else has avoided, Sure. And it's what we do. And almost immediately, people, they feel better. That doesn't mean that it's going to be pain-free. But when the session is over, almost always, I would say 99% of the time, that first session, there's a huge light bulb moment, for that patient, because they realize that the things that they have avoided are actually the things that, are going to get them better. So it's the squatting, the hinging, or, for example, you just sent me a shoulder pain patient this week, and in talking with him, he said he couldn't believe how much overhead,
stuff he could do,
training that we did.
Well, because 2 other doctors told him never to lift overhead again.
And that didn't mean he walked straight in the gym and, I handed him a barbell and we started doing shoulder presses. But we did a lot of other things leading up to it. But it was important in that first session for me to kind of knock down, some of these myths, dispel some of these things that I thought that he couldn't do. Very active person, plays golf, and wasn't necessarily having any trouble doing those things. But what the biggest thing for him, what got him to Dr. Lavelle, was he couldn't sleep. So it's like, you start losing sleep, you'll give up a lot of lifestyle things, but when you start giving up sleep, that one really will stop you in your tracks. So for him, he has this one session. Well, he was like, he couldn't wait to get back in the gym on the second day, because it was more to see, like, what are we going to do? He's already kind of opened up this whole realm of new possibilities of things that he didn't think he should do anymore. Now I'm proving to him that he can, and then I continue to progress it, even in just the second session,
So here's an interesting myth that I think we hear quite a bit, and you've dispelled this many times, is people think there's an incident. They think I picked something up and hurt my back, but as you say it, and as all of the studies will show, it's less than 6%, unless I'm wrong about my statistics, that they actually have an incident. So that in and of itself means you really can't point to any one thing. So if you pointed to all of the things, it would be, like you said, you probably haven't been doing anything.
Yeah.
Now, okay, cool. So we go off of that. I haven't been doing anything and I hurt, or I'm in pain. Now we come to the gym and people will give you the myth of, I think I'm going to get hurt.
Yeah.
Now we both know that people get hurt in the gym.
Yeah.
There's no hiding that. But what I actually spent time and thought about how many catastrophic injuries I've seen over the last 5 years.
Yeah.
And I just tried to do up some of the numbers. I want to know how many you've seen. And by catastrophic injury in the gym, I don't even mean that you've necessarily been working with them.
Yeah.
But how many have you seen live that required surgery?
Over 20 years, one.
Okay. Do you remember what it was?
Yeah.
Now, was it something that was related even to working?
No, it was an underlying issue that actually the athlete knew about, that he just didn't tell anybody about, and was just trying to power through it, I guess.
Okay. It's so unbelievably rare. Again, we've seen tweaks and pulls.
Well, we're talking, literally hundreds of thousands of, and probably into the millions of.
Now I'm really bad at math. I communicated out over 5 years. There were somewhere around 4 million reps that I would personally observe with multiple athletes in a session. And I've seen one catastrophic injury, which was a hamstring tear.
Yeah.
And that came from, and we won't go into where it came from, where the doctor said that it came from. He said it wasn't from working out. I'm not going to go into that. But, which is great. That's fine. Yeah. But after all of that, you're talking about, you still can't even point to an injury where people think injury happens.
Yeah. But
what we see is when you're doing nothing, you tend to hurt quite a bit more.
Yeah.
100%. There's rarely, and I ask it of every single patient I see, what caused it? It's rarely an inciting incident that caused the pain. More often than not, I would argue 80% or more of the time, it just came on one morning. One day I did something that I've done a million times in my life, and I started to feel pain, and it's persisted. There's usually no one incident or trauma or accident. All those things can cause pain, but that on the day-to-day basis, that typically causes pain.
And that should be such a good thing for people to hear, though.
100%.
Well, that's
it should encourage.
Initially, they're frustrated because they want to have a thing, and that thing can be fixed or reversed. When it's what they think is more vague, well, it's just, a little age-related degeneration, and that's also a little bit of a myth. Just because you're getting older doesn't mean you're going to have pain from degeneration. Because if you're staying fit and active, you're going to prevent that. You're going to slow down that rate of degeneration, and you're going to prevent those degenerative areas from becoming painful, as we just talked about. But we do get older. We can see it in our faces from what we were 20 years ago. Same thing on the inside. So it's what we do to protect that is going to prevent that onset of pain.
That leads to another good myth I think we hear about all the time. So let's say we have a 55, 60-year-old deconditioned, never done anything. The myth, maybe it's not a myth. Is it too late to start?
No, it's never too late.
Okay, so you can be 60-year-old, been in the gym the first time.
I'll be 80.
Is there a limit? I probably can't deadlift to over 100 pounds if I'm 50, right? 50, 60, whatever it is.
I think that's untrue.
Okay.
I'm not saying there's no limit, but
but it would be safe for a 60-year-old, again, under appropriate circumstances, to do deadlifts, squats, carries.
it's critical.
They have to do it. I don't even see that it's negotiable. It's like if you're going to live and you're living on your own, unless you're in a assisted living facility, which is what we're really trying to prevent. You have to be doing those things. Otherwise, you're not going to be able to do the routine things around your house. I mean, if you've got a dog, dog food. I mean, pick up a bag of dog food recently. I mean, you're talking 20, 25 pounds. And some of them even bigger.
80 pounds.
Yeah. I mean, it could be 50 pounds. Wow. So it's like, to be boxing yourself in to where you're not picking up weight, it's like you're compromising your quality of life.
You're not loading things. So you're going to get sarcopenia, muscle wasting. You're going to get osteoporosis because the bone's going to degenerate. You're going to get less bone density. So if you're not loading those areas, you're going to develop those processes.
Lay in a bed for 24 hours and see.
Hey, that's another myth, though. So another myth that comes up all the time. I don't think we hear it as much anymore because we put ourselves around people who are working out all day. But when people come in the door, they're like, I thought it was bad, or I was going to wear the joints out if I lifted.
100%.
But it's the other way. Moore's law states that the bone is put against it.
Yeah, and if you keep loading it, you're going to strengthen the bone.
That's right.
If you have no muscles or ligaments and you keep moving something, could it wear out? But the whole point of strength training is to strengthen around that joint to offset it and to stabilize it.
So that's another myth. So you say the whole point of strength training, when done appropriately, I think some people come in and they immediately think, I'm going to have to be here, I'm going to have to see this guy 2 hours a day, 7 days a week. They think it's going to be a complete role reversal where all of their time to be fit is in the gym. What is the minimum effective dose that you normally see to get out of pain?
At least 2. I think 2 to 3 days.
2 for how long? How long each session?
At least an hour.
Okay, so 2 hours a week is a good start to get out of pain.
Great.
And then what generally happens?
So they want more. Yeah, I mean, it quickly turns into three days, and I feel like that's the sweet spot. If you're in the gym 3 days a week, 3 to 4 days a week, you're in a really good place. I feel like it's sustainable. I mean, you're talking, 4 hours a week that you're spending in the gym. So I think at that point, once you get after, I would say 3 months of 2 days a week, people they see noticeable changes.
So say that one more time.
2 days a week for 3 months.
Okay.
Noticeable changes.
Okay.
I mean, at that point, the majority of them are pain-free, and then the rest is at least seeing improvement enough to where they want to continue.
And the sort of program we're talking about is a linear progression, whereas it's not arrive and do this 10 minutes of work and just keep doing this forever and ever, same weight that you came in, peak dumbbell. It's constantly going to something more or trying to.
Well, there's a plan.
Right.
Right. There's a plan. It's like we just don't have a template that we hand, you when you walk in and you just come in each time and do that same thing. I mean, there's that plan, it's built around you, and then it progresses around you we feel like you're ready to go.
Yeah. Let's use your guy that you're talking about with shoulder. Pressing is going to be somehow we're getting to that. Like we might be getting to it, but on our way to that, there might be a list of other exercises.
Well, like right now he has a labral tear. So, I mean, we're doing landmine, presses. We're not on a barbell, trying to press overhead.
Right. But we're also probably doing carries. We're also probably getting on the floor, getting off of the floor. We're probably also squatting. Just because it's a shoulder thing doesn't mean that's the only thing that we work on.
No, because a lot of what he's got going on his shoulder is actually tied to his thoracic spine too. So like we're doing a lot of upper back. I mean, you immediately, that's in session 2. We're already, we're doing some shoulder stuff, but we've already moved on to other areas just because we know how connected everything is. And that, part of the long-term plan is we're going to train the person.
So that's another myth that we hear a lot. I busted my shoulder. I can't work out.
Yeah. Oh, yeah. That one's.
It's the same with any joint. Add the joint into that. Like with your knee, I can't do squats. I can't lunge because I hurt my knee.
That's right.
Maybe I have a little meniscus tear. I see it a lot with people with total knee replacements. They don't want to do squats or lunges because they're trying to protect that joint.
Mm-hmm.
In fact, they're going to wear away that joint quicker because they're not strengthening the capsule around the joint, the ligaments, the muscles, to stabilize that joint to offset it. I think joints will last a lot longer than we think if you're strengthening around it because you're taking pressure off the actual arthrodesis or the hardware that's in that joint.
Yeah, and then the reciprocal effect of actually working one side that is unaffected in the way that it helps the side that is affected. If my arm's in a sling, if I do this thing, it actually makes this thing heal faster.
Well, and I think the big thing that we didn't even talk about is like, man, what it does for your mind. So, I mean, just that you coming in and you being able to do something that you've believed for however many years that you couldn't. I mean, the moment that somebody does that, like the way that it changes their mindset, and which changes their life, and the impact that has, I feel like that's where, I mean, that's why we do what we do.
Well, and that's what's fascinating with that is even maybe they've had pain so long, they have been inactive for so long, they do have enough degeneration where they're always going to get some discomfort, but we all do anyway as we get older from time to time. But now they're in a better mindset because I've told them, you know, you can do everything. You're not going to do any damage. It's safe to do. Yeah, it may cause a little discomfort, but you got to live your life and we want you to have fulfillment in your life and enjoy it. So let's get you to do that. And then they go to you guys and they start doing it in the gym. Just the power of that, knowing, yeah, I got a little back pain after I did this, but man, I was able to hike up Mount LeConte. I was able to do this and it was amazing.
Well, and I think it's just the power of like the way you approach your patients. You approach it from a positive standpoint of like, I'm going to tell you what you can do. I'm not going to sit here and give you a laundry list of all the things that you can't. It's why that every day you're booked solid. It's why people want to see you, because that's contagious. You know, it's like
100%.
And it's so different. I mean, you're intentional about how much time when you're with a patient, like you're with that patient. But you listen and then you try to just reassure them of the things that they can do, not all the things that they can't. And I think that just
it's the most powerful thing.
Huge impact.
You said something that I thought was how people will be quick to remove things.
Yeah.
And I know you and I, big time, are just absolutely terrified. If you have somebody come in and they're like, this is the thing, and then we have to take something away from them. Like, to me, that's heartbreaking. Like, did you just tell me I'm never going to be able to, like, box jump?
Well, when you tell me that, honestly, it makes me like, I go after that right. Even, harder.
Like you said, think about giving that back.
Oh,
when
yeah.
you come in and you're like, I'll never be able to jump again. I'm 60, I should never do that. And we're like, no, we're cool. Yeah. And then you see like somebody who has never jumped before, 65, 70 years old, and they're jumping and they're like, that's the coolest win you get to see. It's cool
when you have them do it too, and they don't even know that they
did. First time experiences at 70 years old.
Just jumped up on a 12-inch box and they didn't even think about it.
Yeah, that's right.
So
what's amazing about that myth we talked about a minute ago, you just touched on, is you're 70, 80 years old. I get that all the time. Well, it's too late for me to start. You're telling me I should start now? Yes. I mean, are you going to be able to grow muscle as quickly or as robustly as a 20-year-old whose testosterone is raging? No. But you're still going to be able to improve your conditioning and your strength and your muscles and your mobility by doing these things. Because like we've said, they're doing this stuff already at home. They, a lot of these older people, maybe single, widowed, they have their dog with them. They got to lift the dog food. That's a deadlift or a squat right there. But they're going to hurt themselves if they're not training those muscles to keep doing it. So if they're doing it anyway, why not condition it so you can keep doing it?
Yeah.
It's fun.
That's all I got, Jim.
It's good stuff.
Thank you so much.
Yeah, awesome. Good job.
If you enjoy what you're hearing and you want to put this into practice and get moving and functioning better, you can commit to 4 weeks. We can get you back in action, get you moving better. Visit thebackinactionpodcast.com. We have some program that we can invite you into and get you moving and feeling the way you want.
Thank you for watching. Join us for much more where that came from. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.